G'day guys, timer is on, happy running. Mine was a very, very wet run today. Hard to get out there, but that just seems to be what it's going to be for this week. But good old STEPN gets you out and about. Hopefully everyone's doing well. It has been a pretty rough ride in crypto today. Been hard to look away from the market, so I hope everyone else is going okay and isn't overextended. And yeah, I think it's wonderful that hopefully if you're not feeling great, that at least STEPN is getting people out and about and focusing on things other than just looking at the markets all day. So hope everyone's doing well. I thought I'd jump in and talk about some other common running injuries that are likely, especially for people who are getting into, not likely, but they're the more common when getting into running for the first time. This is because I've, on my Facebook group, the STEPN Injury Prevention Facebook group, I put a poll up about what types of episodes you guys are keen for the most. And at the moment, I've got types of common running injuries and recovery methods as the top two. Only a couple of votes on there, so it's not exactly an overwhelming vote. But if you haven't already, jump across to the group and let me know which types of episodes you're really interested in and any specific questions you'd like me to answer. But today, going to be talking about what are shin splints and how they may be different to what you think and how they're often confused and how that term is often kind of confused with stress fractures and basically how to avoid both of those injuries happening when you're getting into running. So to start off with, shin splints, it's a kind of it's an unpleasant name. It sort of gives you this idea that there is some kind of splinting, cracking, stress fracture-like thing going on in the body. But the technical term for it is Medial Tibial Stress Syndrome. So what that means is basically the medial is on the kind of inside of the body, as in towards the midline, towards the middle. Tibial is the shin bone, so your tibia is your shin bone. Stress being obviously when you're stressing the body, and then syndrome, that's pretty self-explanatory. So basically you've got this this sort of stress syndrome that's happening inside of your shin. So what is actually going on there is basically when you start to exceed your capacity, and exceeding your capacity is something that I talked quite a lot about in the first episode, and I keep on bringing it up every time because that's one of the most important things to understand with doing any new activity with your body. Is you basically got to gradually increase your exposure to things and not just go all out straight at once. You know, when we were kids, we used to get away with just doing random sports at random times and not really worrying about it. But as you get older, you really need to make your ramp up into new activity a bit slower, so you give your body more time to adapt. And remember, muscles, your neurological system kind of adapts the fastest, so your ability to produce force with the muscles you have, then your muscles adapt, and then your bones, ligaments, cartilage all kind of take a bit longer. But always happening, always in a constant state of remodeling. So what can happen is basically on that inside of your shin, you've got a few different muscles that attach onto the inside of the shin there. And what can happen is when you get that capacity overload and the resultant muscle spasm. So I've talked a lot about how, when you, a lot of the tightness that you get when you're starting new exercise and pain and tightness that you're getting that people just want to stretch, that's actually caused by like a muscle not being able to handle the load that's been put on it. So if you've got this kind of overload of the musculature, you basically every time you're contracting that muscle, that's going to be pulling on the bony attachment, and you've kind of got this like spread out bony attachment on the side of your shin. And if you suddenly increase your running in a big way or change what you've been doing, lots more walking than you've done in the past, then that kind of continuous pulling on the attachment site that's not ready for it can be a bit stressful. So and that's what then starts to cause the pain. So again, it is this too much too soon idea that we want to avoid, and luckily with STEPN it does kind of slow you down by the way of only having 10 minutes available at the beginning. But if you do go in all in pretty quickly, certainly 45 minutes running a day if you're up at that high energy level, could be really challenging. So things that are going to impact this as well are basically like the strength of the foot musculature and the ankle musculature and your calves. So if you're not quite as strong through those muscles, and especially if your calves become quickly fatigued, then the other deeper muscles, so these muscles that actually attach onto this point, more of your sort of foot and ankle stabilize muscles, but they can play a role in force development. So if you're suddenly going from not much running to a lot of running and your calves get quite fatigued quite quickly, you start to look at your muscles will start to, your brain will start to tap into the other muscles that are there to do the job, and those muscles get really overloaded quite quickly because it's not their job to be producing that sort of that moving force, and that's where you can really overload it quite quickly. So what it feels like is basically on the inside of your shin, like a pretty horrible pain along the inside of your shin. When you press through there, all along that area, it can be pretty horribly painful, and it can really slow you down. So this is definitely something we want to avoid. And again, the main way of doing it is by gradually increasing your loading, but then also doing some strengthening work through your calves, and also some ankle and foot stability work with single leg balance, as well as work up through the hip to make to lower the demand of the stabilizers of the ankle. Again, we'll get stuck into uploading a program, particularly if people are interested. So let me know if you would like that strength program as a priority. So that's the medial tibial stress syndrome in a quick nutshell. So this is kind of not to be confused, but the really challenging thing with this is it's common for people to, I guess, feel some symptoms and then go with the first injury, like the most likely injury that they've heard of. And I guess a lot of people sort of talk about shin splints and sort of use it fairly haphazardly. But when you actually look at all the different conditions that it could be, you've got there's so many other ones. That's why it is really important to work with a professional to make sure you know what you're working with, because just because it's pain in that area doesn't necessarily mean it's going to be shin splints. So other things that it can be, as I said, with stress fractures, but then also compartment syndrome, which is basically where the musculature starts to swell within its fascia and that can really cause some issues with basically like closing down space for blood vessels and nerves to run through. So that's something that you really want to be kind of on top of. Also sciatica, so back pain, which has a nerve component that goes down to the back of the shin, is a really common one. Deep vein thrombosis as well can kind of masquerade as a similar sort of thing, where you've got pain down the back of your calf. You've got these arteries that go through the back of your knee called the Popliteal Artery Entrapment. There's muscle strains you can get through there. Tumours, obviously it's not common, but that is a possibility. And then there's a few other things like infections, other nerve entrapments, and arterial endofibrosis, which again, I won't go into the details here, but I just wanted to highlight that list because again, it's really common that people just jump on, look at Google, look for the few symptoms that they have, and then just assume it's that. But that list is a good kind of highlight of why you would want to go see a health professional. A physiotherapist in Australia, at least, is definitely going to be the person to see for something like this, where we have the skills and knowledge, the understanding the questions of how to differentially diagnose. So knowing what are the little things that make the difference between those conditions, so that you can make sure you know what you're working with, because quite a few of those things, like particularly if it is a tumor or your deep vein thrombosis, those kind of things can actually be life-threatening. So not to scare you guys, but again, if you do have a new injury, new pain that you're not sure about, it is always really good to work with a professional. Again, that's something I do online. If you are interested, jump on the group, get in contact with me. But otherwise, seeing someone local to you is always good. Coming up to the end of the time, but with stress fractures, I just wanted to highlight that is different to shin splints. So if you've been told you have shin splints, that doesn't mean you have stress fracture. That can be a result of a long-term if you really, really push through shin splint-like pain, particularly if you have a few other things going on like hormonal changes. If you're eating at a massive calorie deficit, there's the timer. Calorie deficit being basically you're on a strict diet and you're not eating enough. And yeah, it can be a common thing for... Sorry, I'm in the middle of nearly sneezing here, so excuse me while I just... Okay, I think it's gone. But basically, there's this idea called the female athlete triad, which is when you stop having your period, amenorrhea. You've got some changes to hormones from under eating, and that can basically be a common time when stress fractures will come up. So it's not eating enough, not getting enough recovery in there, and that's a common time when stress fractures might come up. So just that sneeze really threw me there. Oh, it's hard to talk when you're focused on not sneezing everywhere. Sorry about that. But yeah, that does come to the end of the time. I might, if people are interested in going further into stress fractures, because certainly foot and those lower leg stress fractures can be a real, like that's the kind of injury where you have to stop running. Like with this, I'm really trying to give people the tools to be able to continue running and continue earning on STEPN, but there are going to be certain times when you really do need to stop, and fractures are one of those times. So if you are interested in learning more about it, I can go further into it, but otherwise I'll finish up for today. Again, hope everyone's going all right with the market downturn. Just keep getting out there, keep enjoying being outside and looking at looking at the bigger picture, I guess, because it can be so engrossing just watching charts. So hopefully you have a happy outlet. If you do want any more help with anything, jump on the STEPN Injury Prevention Facebook group and send me a message. If you would like to request any topics, that's the place to do it. And I really appreciate any feedback you have. So hope you have a great rest of your day, and I'll see you again tomorrow.